Hi, I'm Mark Johnson, your educator at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. This innovative AI-powered question bank adjusts to your performance and provides audio rationales for a unique and efficient review process. For full access, please refer to the description box below. Have your notebook ready and follow along as we sharpen your critical thinking skills. Let's get started with question 1.
A 55-year-old client with amyotrophic lateral sclerosis, ALS, is experiencing significant anxiety and depression as their disease progresses. The client expresses feelings of hopelessness and a desire to withdraw from social activities. What is the most appropriate nursing intervention to support the client's mental health and enhance their coping skills? Encourage the client to join a support group for individuals with ALS. Suggest the client focus on completing advanced care planning. Recommend the client increase their physical therapy sessions. Advise the client to spend more time alone to reflect on their condition. The correct answer is A. Rationale. Correct answer, the first option. Joining a support group can provide the client with a sense of community and understanding from others facing similar challenges, which can alleviate feelings of isolation and hopelessness. Support groups offer emotional support and practical advice, enhancing coping skills and empowering the client to manage their mental health. This intervention aligns with psychosocial care by addressing the client's emotional and social needs, helping them build resilience in the face of a progressive illness. Distractor rationales. B. The second option. While advanced care planning is important, focusing solely on future decisions may increase feelings of anxiety and distress about the disease progression. C. The third option. Increasing physical therapy may improve physical function, but does not directly address the client's mental health needs or provide emotional support. D. The fourth option, advising the client to spend more time alone, can exacerbate feelings of isolation and depression, which is not beneficial for mental well-being. Clinical tip. Encouraging participation in support groups can significantly benefit clients with chronic illnesses by providing emotional support and practical coping strategies. A 16-year-old male with a new diagnosis of type 1 diabetes is struggling to manage his condition and shows signs of depression. He often misses insulin doses and isolates himself from friends. As his school nurse, which intervention is most appropriate to support his mental health and diabetes management? Here are the options. Option 1. Arrange for peer support with other teens managing diabetes. Option 2. Provide him with additional educational pamphlets on diabetes. Option 3. Schedule more frequent blood glucose monitoring. Option 4. Encourage him to participate in a competitive sports team. The correct answer is A. Rationale. Correct answer. The first option. Arranging for peer support with other teens managing diabetes is the most appropriate intervention, as it addresses both his mental health and diabetes management. Peer support can reduce feelings of isolation, provide emotional support, and offer practical advice from others who understand his situation. It fosters a sense of belonging and can improve adherence to treatment regimens. This approach recognizes the psychosocial impact of chronic illness on adolescents. Distractor rationales. B. The second option. Providing educational pamphlets may increase knowledge, but does not address the psychosocial needs or emotional support required. C. The third option. More frequent glucose monitoring focuses on diabetes management alone, but neglects the psychological and social components of his care. D. The fourth option, encouraging participation in competitive sports could increase stress and does not directly address his mental health needs. Clinical tip. Interdisciplinary care that includes mental health support is crucial for young patients with chronic illnesses like diabetes, as these conditions can significantly impact emotional and social well-being. A 10-year-old child with neurogenic bladder is being seen in the pediatric clinic for routine follow-up. The nurse is educating the child's parents about health promotion strategies to maintain urinary tract health and prevent complications. Which recommendation should the nurse emphasize as a priority for this child? Here are the options. Option 1. Encourage the child to drink cranberry juice daily. Option 2. Teach the child to perform clean intermittent catheterization regularly. Option 3. Suggest limiting fluid intake to avoid bladder overdistension. Option 4. Advise using antibiotics prophylactically to prevent infections. The correct answer is B. Rationale. Correct answer, the second option. Teaching clean intermittent catheterization, CIC, is crucial for children with neurogenic bladder, as it helps in preventing urinary tract infections and bladder overdistension. Regular CIC promotes bladder health and is an essential self-care skill as the child grows. It maximizes the child's independence and prevents complications such as renal damage. Encouraging a routine with CIC supports both physical health and developmental milestones in self-care for the child. Distractor rationales. A. The first option. While cranberry juice is often suggested for urinary health, its effectiveness in preventing UTIs in children with neurogenic bladder has limited evidence. C. The third option. Fluid restriction can lead to dehydration and does not prevent urinary tract infections. Maintaining adequate hydration is important. D. The fourth option. Prophylactic antibiotics are not typically recommended due to the risk of resistance and should be used only if prescribed by a healthcare provider. Clinical tip: empower pediatric patients with chronic conditions by teaching age-appropriate self-care skills, fostering independence and self-management as they develop. A patient 72 hours post-catheterization is experiencing tumor lysis syndrome with hyperkalemia. Assessment shows muscle twitching, mixed metabolic acidosis, CVP 6 mm mercury, and recent therapy changes including stopped diuretics and increased insulin. Labs: K plus 6.5 milliequiliters, Ca 2 plus 7.8 milligrams deciliter, creatinine 2.1 milligrams deciliter. Select the appropriateness for each intervention. T8T, intervention indicated, contraindicated, no effect. Table: administer calcium gluconate. NPTD, in parentheses, journal or lines for each intervention. Table: you continue holding diuretics. Table: continue holding diuretics. Table: administer IV fluids. Table: in parentheses, journal or lines for each intervention. Table: administer IV fluids. Table: in parentheses, journal or lines for each intervention. Rationale. Row 1. Administer calcium gluconate. Indicated to stabilize cardiac membranes in hyperkalemia, preventing arrhythmias. This is a critical intervention to prevent life-threatening cardiac events. American Heart Association, 2023. Row 2. Start sodium bicarbonate infusion. Contraindicated due to risk of volume overload and lack of severe acidosis. It should be reserved for significant acidosis cases. Nephrology Update, 2023. Row 3. Continue holding diuretics. Contraindicated as diuretics aid in renal clearance of potassium, crucial in hyperkalemia management. Resuming diuretics can help manage elevated potassium levels. Oncology Guidelines, 2023. Row 4. Increase insulin dosage. Indicated to drive potassium into cells, reducing serum levels effectively. Insulin is effective in rapidly reducing serum potassium levels. Endocrinology Practice, 2023. Row 5. Administer IV fluids. Indicated to dilute serum potassium and support renal excretion, Mitigating hyperkalemia. Adequate hydration is essential in managing electrolyte imbalances. Fluid Management Protocol 2023. Distractor rationales. 1. Calcium gluconate is essential for counteracting the cardiac effects of hyperkalemia by stabilizing myocardial cells, preventing arrhythmias. This is a critical intervention in hyperkalemia management. American Heart Association 2023. 2. Sodium bicarbonate is not appropriate here as the patient does not exhibit severe acidosis, and its use could lead to fluid overload, complicating the patient's condition. It should be reserved for cases with significant acidosis. Nephrology Update 2023. 3. Holding diuretics is inappropriate because they facilitate potassium excretion, which is crucial in managing hyperkalemia, unless contraindicated by hypovolemia. Resuming diuretics can help manage the elevated potassium levels. Oncology Guidelines 2023. 4. Increasing insulin dosage is necessary to promote intracellular potassium shift, but it must be balanced with glucose monitoring to prevent hypoglycemia. Insulin is effective in rapidly reducing serum potassium levels. Endocrinology Practice 2023. 5. IV fluids are crucial for enhancing renal perfusion and promoting potassium excretion, thus mitigating hyperkalemia and supporting renal function. Adequate hydration is essential in managing electrolyte imbalances. Fluid Management Protocol 2023. Clinical tip. No clinical tip provided. A 58-year-old male with a history of hypertension presents to the emergency department with chest pain radiating to his left arm and diaphoresis. His ECG shows ST segment elevation. Which medication should the nurse anticipate administering first to address the client's acute coronary syndrome? Here are the options. Option 1. Aspirin. Option 2. Nitroglycerin. Option 3. Morphine. Option 4. Atorvastatin. The correct answer is A. Rationale. Correct answer, the first option. Aspirin should be administered first in the case of acute coronary syndrome as it acts to inhibit platelet aggregation, reducing the risk of further clot formation. This is a critical step in the early management of myocardial infarction. While nitroglycerin can help alleviate chest pain by vasodilation, aspirin addresses the underlying pathophysiology. Morphine is used for pain management, and atorvastatin is for long-term cholesterol management, neither of which are immediate priorities. Distractor rationales. B. The second option. Nitroglycerin is important for pain relief but does not address the clotting process directly. C. The third option. Morphine is used for pain relief but is not the first-line treatment in acute coronary syndrome. D. The fourth option. Atorvastatin is used for cholesterol management and is not an immediate treatment for acute coronary syndrome. Clinical tip. In acute coronary syndrome, administering aspirin promptly can significantly reduce mortality by preventing further clot formation. A 45-year-old client with encephalitis is admitted to the hospital. The client exhibits confusion, irritability, and fluctuating levels of consciousness. The client's spouse expresses feelings of helplessness and anxiety about the client's condition. Which nursing intervention should the nurse prioritize to support the spouse's psychosocial needs? Here are the options. Option 1. Provide detailed medical explanations about encephalitis to the spouse. Option 2. Encourage the spouse to participate in the client's care activities. Option 3. Facilitate a meeting with a hospital chaplain for spiritual support. Option 4. Arrange for the spouse to join a support group for families of patients with neurological conditions. The correct answer is D. Rationale. Correct answer, the fourth option. Arranging for the spouse to join a support group for families of patients with neurological conditions is the best intervention. Support groups provide a platform for sharing experiences, reducing feelings of isolation, and gaining coping strategies from others in similar situations. This intervention addresses the spouse's psychosocial needs by offering emotional support and practical advice. It also empowers the spouse by connecting them with a community that understands their challenges. Distractor rationales. A. The first option. While providing medical explanations can be helpful, it may not directly address the spouse's emotional and psychosocial needs. B. The second option. Encouraging participation in care activities may increase stress if the spouse is already feeling overwhelmed. C. The third option. Spiritual support can be beneficial, but it may not be the primary need if the spouse is seeking peer support and practical advice. Clinical tip. In situations involving chronic or severe illness, connecting family members with support groups can significantly enhance their coping mechanisms and provide a sense of community. A client with Graves' disease shows signs of thyroid storm. What is the nurse's priority action? Here are the options. Option 1. Isolate the client. Option 2. Administer beta blockers. Option 3. Initiate IV fluids. Option 4. Give acetaminophen. The correct answer is 1. Rationale, correct answer. Isolating the client is a priority to prevent exposure to potential stressors and infections that could exacerbate a thyroid storm. Stress and infections can trigger or worsen a thyroid storm, a life-threatening condition associated with Graves' disease. Maintaining a calm environment helps minimize additional stress, thereby reducing the risk of further hormone release. Isolation also protects the client from acquiring infections from others, which could complicate the clinical picture. Distractor rationales. 2. While beta blockers are essential to manage symptoms, preventing exposure to triggers is more crucial initially. 3. IV fluids are important for hydration, but do not directly prevent exacerbation due to infection or stress. 4. Antipyretics like acetaminophen address fever, but do not prevent the onset of symptoms triggered by external stressors. Clinical tip. In clients with Graves' disease at risk for thyroid storm, minimizing stress and exposure to infections is critical. Prioritize environmental control to prevent exacerbations. A 68-year-old client with a history of mitral stenosis is admitted to the hospital with worsening dyspnea and fatigue. The client is on a low-sodium diet and takes furosemide daily. Current vital signs are BP 110 70 millimeters of mercury, HR 88 beats per minute, RR 24 breaths per minute, SpO2 92% on room air. Which nursing intervention should be prioritized to address the client's current condition? Here are the options. Option 1. Administer supplemental oxygen via nasal cannula. Option 2. Increase the client's furosemide dose. Option 3. Encourage the client to ambulate in the hallway. Option 4. Provide a high-sodium snack to increase energy. The correct answer is A. Rationale. Correct answer, the first option. Administering supplemental oxygen via nasal cannula is the correct intervention to prioritize for this client. The client is experiencing dyspnea and has an SpO2 of 92%, indicating mild hypoxemia. Providing oxygen can help improve oxygen saturation and alleviate respiratory distress. This intervention directly addresses the client's immediate need for improved oxygenation, which is critical in the context of mitral stenosis, where pulmonary congestion can occur. Monitoring and maintaining adequate oxygen levels is essential to prevent further complications. Distractor rationales. B. The second option. Increasing the client's furosemide dose without a provider's order could lead to electrolyte imbalances and is not the immediate priority. C. The third option, encouraging ambulation, is not appropriate at this time due to the client's dyspnea and low oxygen saturation. D. The fourth option, providing a high-sodium snack contradicts the client's dietary restrictions and could exacerbate fluid retention. Clinical tip. In clients with mitral stenosis, monitor for signs of pulmonary congestion, and prioritize interventions that improve oxygenation and reduce respiratory distress. A 3-month-old infant has been diagnosed with Hirschsprung's disease and is scheduled for surgery. The parents are concerned about their child's growth and development. Which nursing intervention is most appropriate to promote the infant's growth and development preoperatively? Here are the options. Option 1. Encourage the parents to provide frequent skin-to-skin contact. Option 2. Advise the parents to introduce solid foods to improve nutrition. Option 3. Suggest limiting the infant's fluid intake to prevent abdominal distension. Option 4. Recommend postponing vaccinations until after surgery. The correct answer is A. Rationale. Correct answer, the first option. Encouraging frequent skin-to-skin contact is crucial for promoting bonding and emotional development, which are vital aspects of growth and development in infants. This intervention supports the infant's psychosocial needs and can help reduce stress, which may positively impact physical growth. Skin-to-skin contact is a non-invasive method that can be easily implemented preoperatively without interfering with medical treatment. Distractor rationales. B. The second option. Introducing solid foods at 3 months is not recommended, as infants are typically not developmentally ready for solids until around 6 months. C. The third option. Limiting fluid intake is inappropriate, as it can lead to dehydration and does not address growth and development needs. The fourth option. Postponing vaccinations is not advised unless specifically directed by a healthcare provider, as maintaining the vaccination schedule is important for preventing infections. Clinical tip. Skin-to-skin contact, also known as kangaroo care, is beneficial for infants' emotional and physical development, especially in stressful situations like preoperative care. A 45-year-old client with Huntington's disease is admitted to a long-term care facility. The client demonstrates involuntary movements and difficulty swallowing. Which nursing intervention should be prioritized to ensure the client's safety? Here are the options. Option 1. Encourage the client to ambulate independently to maintain mobility. Option 2. Provide soft, small, frequent meals to reduce the risk of aspiration. Option 3. Instruct the client to perform swallowing exercises twice daily. Option 4. Place all personal items within reach to encourage independence. The correct answer is B. Rationale. Correct answer, the second option. Providing soft, small, frequent meals helps minimize the risk of aspiration, which is a significant concern for clients with Huntington's disease due to dysphagia, difficulty swallowing. Involuntary movements can increase the risk of choking, making it crucial to adapt dietary consistency and eating patterns. This intervention directly addresses the safety and effective care environment by preventing potential choking hazards. The focus on aspiration prevention aligns with the nurse's role in safeguarding the client's immediate physical well-being. Distractor rationales. A. The first option, encouraging independent ambulation without supervision, might increase the risk of falls due to the client's involuntary movements. C. The third option. While swallowing exercises can be beneficial, they do not address the immediate safety concern of preventing aspiration during meals. D. The fourth option. Placing items within reach does not directly address the immediate risk of choking or aspiration related to dysphagia. Clinical tip. In clients with neurological disorders affecting swallowing, prioritizing meal consistency adaptations and safe feeding practices can significantly reduce the risk of aspiration and consequent respiratory complications. A client with a history of pulmonary edema is stable. What should the nurse prioritize to prevent recurrence? Here are the options. Option 1. Administer oxygen. Option 2. Encourage deep breathing. Option 3. Manage fluid intake. Option 4. Initiate high-calorie diet. The correct answer is 3. Rationale. Correct answer. Managing fluid intake and monitoring daily weights are critical in preventing recurrence of pulmonary edema, particularly in clients with underlying cardiac issues. Controlling fluid balance helps prevent fluid overload, which can exacerbate pulmonary congestion and lead to edema. Daily weights provide a quick and effective method for detecting early signs of fluid retention, allowing for prompt intervention. Distractor rationales. 1. Administering oxygen addresses acute symptoms, but does not prevent recurrence. 2. Deep breathing exercises improve ventilation, but do not address fluid overload, the underlying cause of pulmonary edema. Clinical tip. Educate clients with heart failure about the importance of adhering to fluid restrictions and recognizing early signs of fluid retention. A 45-year-old male client with a history of hypertension and recent antibiotic use presents with fatigue, fever, and flank pain. Laboratory results show elevated creatinine and eosinophilia, suggesting interstitial nephritis. Which nursing intervention is most appropriate to address the client's basic care needs? Here are the options. Option 1. Encourage increased fluid intake to flush out toxins. Option 2. Administer antihypertensive medication as prescribed. Option 3. Monitor intake and output closely to assess kidney function. Option 4. Provide a high-protein diet to support kidney repair. The correct answer is C. Rationale. Correct answer. The third option. Monitoring intake and output closely is crucial in assessing kidney function and fluid balance in a client with interstitial nephritis. This condition can lead to impaired renal function, and tracking fluid status helps in early detection of worsening renal impairment. Accurate measurement of intake and output can guide further treatment decisions and prevent complications such as fluid overload or dehydration. This intervention aligns with basic care principles by ensuring the client's physiological needs are met. Distractor rationales. A. The first option. Encouraging increased fluid intake may worsen fluid overload if renal function is compromised. B. The second option. While managing hypertension is important, it does not directly address the basic care needs related to renal function monitoring. D. The fourth option. A high-protein diet can exacerbate kidney damage by increasing the workload on the kidneys. Clinical tip. In clients with renal issues, always prioritize interventions that help monitor and maintain renal function, such as tracking intake and output. A 17-year-old client has been diagnosed with meningococcemia and is currently in isolation in the hospital. The client expresses feelings of loneliness and fear about their condition. As the nurse, what is the most appropriate initial action to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to express their feelings and concerns. Option 2. Provide educational materials about meningococcemia. Option 3. Arrange for a family member to visit the client. Option 4. Administer prescribed anxiolytic medication. C. The correct answer is A. Rationale. The first option. Encouraging the client to express their feelings and concerns is the most appropriate initial action. This approach helps establish trust and provides emotional support, which is crucial for a client in isolation experiencing fear and loneliness. It allows the nurse to assess the client's mental state and identify specific psychosocial needs. Addressing emotional concerns can reduce anxiety and improve the client's overall well-being, facilitating better coping mechanisms during their hospital stay. Distractor rationales. B. The second option. While providing educational materials is important, it does not directly address the client's immediate emotional needs and may overwhelm them if they are anxious. C. The third option. Arranging for a family member to visit can be beneficial, but it may not be feasible immediately due to isolation protocols and does not address the client's current emotional state. D, the fourth option. Administering anxiolytic medication may be necessary if the client is experiencing severe anxiety, but it should not be the first step without exploring non-pharmacological interventions. Clinical tip. When addressing psychosocial needs, always prioritize establishing a therapeutic relationship and open communication to better understand and support the client's emotional and mental health. An older adult client with normal pressure hydrocephalus, NCLEX, is admitted to the long-term care unit. The client exhibits difficulty with balance, mild dementia, and urinary incontinence. What is the most appropriate nursing intervention to address the client's basic care needs? Here are the options. Option 1. Encourage the client to ambulate independently to maintain mobility. Option 2. Implement a toileting schedule to manage urinary incontinence. Option 3. Provide a high-protein diet to promote cognitive function. Option 4. Administer diuretics to reduce cerebral spinal fluid volume. The correct answer is B. Rationale. Correct answer, the second option. Implementing a toileting schedule is an essential basic care strategy for managing urinary incontinence, a common symptom in clients with normal pressure hydrocephalus. This intervention helps prevent skin breakdown from prolonged exposure to urine and maintains the client's dignity. Additionally, it may help improve the client's quality of life by reducing the frequency of incontinence episodes. Nurses play a crucial role in providing structured routines that accommodate the client's physiological needs, especially in a long-term care setting. Distractor rationales. A, the first option. Encouraging independent ambulation might increase the risk of falls, given the client's balance difficulties, which can worsen NPH symptoms. C, the third option. While a high-protein diet is generally healthy, it does not directly address the basic care needs associated with NPH, such as incontinence. D, the fourth option. Diuretics are not typically used to treat normal pressure hydrocephalus and may lead to dehydration and electrolyte imbalances. Clinical tip. In clients with NPH, structured routines like toileting schedules can help manage symptoms and prevent complications such as skin breakdown. A 45-year-old male resident in a long-term care facility has been diagnosed with active pulmonary tuberculosis. He is currently on a medication regimen including isoniazid, rifampin, and pyrazinamide. As part of basic care, what is the most important action the nurse should take to ensure adherence to the treatment plan? Here are the options. Option 1. Provide the medications with meals to reduce gastrointestinal upset. Option 2. Observe the client taking each dose of the medications. Option 3. Instruct the client to report any changes in vision immediately. Option 4. Encourage increased fluid intake to prevent renal complications. ... The correct answer is B. Rationale. Correct answer, the second option. Observing the client taking each dose of the medications, known as directly observed therapy, DOT, is the most important action to ensure adherence to the tuberculosis treatment plan. This method helps prevent the development of drug resistance and ensures the complete eradication of the infection. By witnessing the client take the medication, the nurse can verify compliance and address any issues with side effects on the spot. This strategy is crucial in managing tuberculosis effectively, especially in a long-term care setting where routine and consistency are key. Distractor rationales. A, the first option, providing medications with meals, might help with gastrointestinal upset, but is not the primary strategy to ensure adherence. C, the third option, reporting changes in vision, is important for monitoring side effects, but it does not directly ensure medication adherence. D, the fourth option, encouraging fluid intake is beneficial, but not directly related to ensuring adherence to the tuberculosis medication regimen. Clinical tip. Directly observed therapy, DOT is a key strategy in tuberculosis management to ensure compliance and prevent drug resistance. It involves healthcare workers observing patients take their medication. A 45-year-old male is admitted to the emergency department with a suspected brain abscess. He presents with severe headache, fever, and altered mental status. Which action should the nurse take first to ensure the patient's safety? Here are the options. Option 1. Administer prescribed antibiotics immediately. Option 2. Prepare the patient for an urgent CT scan. Option 3. Initiate seizure precautions. Option 4. Obtain a detailed history from the family. The correct answer is C. Rationale. Correct answer, the third option. Initiating seizure precautions is the priority action to ensure the patient's safety, given the altered mental status and the risk of seizures associated with a brain abscess. This intervention helps prevent injury during potential seizure activity, which is a critical safety concern in this scenario. Distractor rationales. A. The first option. While administering antibiotics is important, ensuring immediate safety through seizure precautions takes precedence. B. The second option. A CT scan is necessary for diagnosis but does not address the immediate safety risk of seizures. D. The fourth option. Obtaining a history is important but not the immediate priority when addressing potential seizure risk. Clinical tip. In cases of neurological compromise, always prioritize interventions that address immediate safety risks, such as seizure precautions, to prevent injury. Minutes before change of shift report, the charge nurse is called to assess a middle-aged client who exhibits signs of paranoia and refuses to take medications, claiming they are being poisoned. What is the most appropriate response? Here are the options. Option 1. Acknowledge the client's feelings and provide reassurance. Option 2. Document the client's refusal and notify the healthcare provider. Option 3. Coax the client to take the medication despite their fears. Option 4. Validate the client's feelings and explore their concerns. Period. Rationale. Correct answers. The first option, the second option, the fourth option. The first option, acknowledging feelings without confrontation, helps build trust and rapport. The second option, documenting refusal, is essential for legal and medical records and for further management. The fourth option, validating and exploring concerns, can lead to understanding underlying issues and fears. Distractor rationales. C. The third option, attempting to coax, can increase mistrust and is not therapeutic. E. Administering medications covertly breaches ethical principles and can damage trust. Clinical tip. Building therapeutic rapport is crucial in managing clients experiencing paranoia, as it can facilitate cooperation and trust. Memory aid. PACE. Paranoia. Acknowledge, communicate, explore. Minutes before change of shift report, the charge nurse is called to assess a 30-year-old client in the ICU who is experiencing anaphylactic shock. What is the nurse's priority action? Here are the options. Option 1. Administer epinephrine intramuscularly. Option 2. Start an intravenous line for fluid administration. Option 3. Place the client in a Trendelenburg position. Option 4. Notify the healthcare provider immediately. The correct answer is A. Rationale. Correct answer, the first option. Administering epinephrine intramuscularly is the priority to counteract the severe allergic reaction and prevent further deterioration. Distractor rationales. B. The second option. Starting an IV line is important, but secondary to administering epinephrine. C. The third option. Trendelenburg position is not recommended as it can worsen respiratory distress. D. The fourth option, notifying the healthcare provider is necessary, but does not take precedence over the immediate administration of epinephrine. Clinical tip. In anaphylaxis, epinephrine is the first-line treatment and should be administered without delay. Memory aid. Epi first in anaphylaxis. A 35-year-old client with antisocial personality disorder is admitted to the psychiatric unit following an altercation at a local bar. The client has a history of aggressive behavior and is currently agitated, pacing the room and making threats. The provider has ordered a PRN sedative. What is the nurse's priority action to ensure a safe environment? Here are the options. Option 1. Administer the PRN sedative immediately. Option 2. Attempt to verbally de-escalate the situation. Option 3. Call security to restrain the client. Option 4. Remove other clients from the area. The correct answer is D. Rationale. Correct answer, the fourth option. Removing other clients from the area is the priority action to ensure the safety of all individuals in the environment. This action minimizes the risk of harm to others while allowing the nurse to focus on managing the agitated client. Although administering a sedative and de-escalating are important, ensuring the safety of others takes precedence in an emergency situation. Distractor rationales. A. The first option, administering a sedative may be necessary but does not address immediate safety concerns for others. B. The second option, verbal de-escalation is important but may not be effective in ensuring immediate safety. C. The third option, restraining the client should be a last resort and requires a team approach. Clinical tip, in situations involving potential violence, prioritize the safety of all individuals by removing them from the immediate area if possible. A 45-year-old client is admitted to the hospital with a diagnosis of hyperthyroidism. The nurse is preparing to educate the client about managing symptoms at home. Which instruction should the nurse prioritize to help the client cope with common symptoms of hyperthyroidism? Here are the options. Option 1. Increase fluid intake to stay hydrated. Option 2. Engage in high-intensity exercise daily. Option 3. Wear lightweight, breathable clothing. Option 4. Consume high-calorie, high-protein meals. The correct answer is C. Rationale. Correct answer, the third option. Wearing lightweight, breathable clothing helps the client manage symptoms of heat intolerance and excessive sweating, which are common in hyperthyroidism. This clothing choice keeps the body cooler and prevents overheating, improving comfort. Hyperthyroidism increases metabolic rate, leading to increased heat production. By dressing appropriately, clients can reduce discomfort associated with these symptoms. Providing education on managing these widely experienced symptoms is a key nursing responsibility. Distractor rationales. A. The first option. While staying hydrated is important, increasing fluid intake does not directly alleviate the symptoms of hyperthyroidism, such as heat intolerance. B. The second option. High-intensity exercise might exacerbate symptoms like tachycardia and fatigue, making it an inappropriate recommendation for managing hyperthyroidism. D. The fourth option. While maintaining adequate nutrition is important, the question focuses on managing immediate symptoms like heat intolerance. Clinical tip. For clients with hyperthyroidism, suggest frequent rest periods and environments that are cool and stress-free to help manage symptoms effectively. A 35-year-old client with a history of dissociative identity disorder is admitted to the psychiatric unit. The client presents with multiple personalities and reports frequent episodes of amnesia. The nurse is planning care for this client. Which nursing intervention should be prioritized to ensure the client's physiological integrity? Here are the options. Option 1. Encourage the client to express feelings through journaling. Option 2. Establish a consistent daily routine for the client. Option 3. Provide a low-stimulation environment to prevent sensory overload. Option 4. Administer prescribed anxiolytics to manage anxiety. The correct answer is B. Rationale, correct answer, the second option. Establishing a consistent daily routine is crucial for clients with dissociative identity disorder, as it helps provide a sense of stability and predictability, which can reduce anxiety and confusion. This intervention supports the client's physiological integrity by minimizing stress and promoting a structured environment that can help manage dissociative episodes. Consistency in care can also aid in the integration of different identities by providing a reliable framework for the client. Distractor rationales. A. The first option. While journaling can be therapeutic, it does not directly address the physiological integrity or safety needs of the client. C. The third option. A low-stimulation environment may help with anxiety, but does not specifically address the need for routine and structure. D. The fourth option, administering anxiolytics, can manage anxiety, but does not provide the structural support needed for physiological integrity. Clinical tip: for clients with dissociative disorders, maintaining a consistent routine can help reduce confusion and anxiety, supporting both psychological and physiological well-being. A 35-year-old client with newly diagnosed hyperthyroidism is admitted to the psychiatric unit due to acute anxiety and insomnia. The client reports feeling overwhelmed and unable to cope with daily activities. Which nursing intervention should the nurse prioritize to address the client's psychosocial needs? Here are the options. Option 1. Provide education about hyperthyroidism and its effects on mental health. Option 2. Encourage the client to participate in group therapy sessions. Option 3. Administer prescribed anxiolytic medication to reduce anxiety. Option 4. Facilitate a quiet environment to promote rest and sleep. The correct answer is C. Rationale. Correct answer, the third option. Administering prescribed anxiolytic medication is the priority intervention to quickly reduce the client's acute anxiety, which is exacerbated by hyperthyroidism. This action addresses the immediate psychosocial distress and helps stabilize the client's mental state, allowing them to better engage in other therapeutic activities. Hyperthyroidism can cause heightened anxiety and insomnia, and managing these symptoms pharmacologically is crucial in the acute phase. Once the anxiety is controlled, the client can benefit more from educational and therapeutic interventions. Distractor rationales. A. The first option. While education is important, it does not address the immediate psychosocial distress caused by acute anxiety. B. The second option. Group therapy can be beneficial, but the client may not be able to participate effectively until their anxiety is managed. D. The fourth option. A quiet environment can help with sleep, but it does not directly address the acute anxiety the client is experiencing. Clinical tip: in cases of acute anxiety related to medical conditions, pharmacological interventions can provide rapid relief, allowing clients to engage more effectively in psychosocial therapies. A 2-year-old child diagnosed with respiratory syncytial virus (RSV) is being discharged from the hospital. The child's parents express feeling overwhelmed by the care requirements at home. What is the best nursing intervention to support the parents' coping abilities? Here are the options. Option 1. Provide a detailed written care plan and instructions. Option 2. Arrange for a follow-up appointment with the pediatrician. Option 3. Offer to connect them with a home health nurse for support. Option 4. Teach them relaxation techniques to manage stress. The correct answer is C. Rationale. Correct answer, the third option. Offering to connect the parents with a home health nurse provides ongoing support and reassurance, which can significantly enhance their coping abilities. A home health nurse can offer practical assistance, answer questions, and provide emotional support, helping to alleviate the parents' feelings of being overwhelmed. This intervention aligns with the principles of continuity of care and supports the family's ability to manage the child's condition at home. Distractor rationales. A. The first option. While a written care plan is useful, it may not address the emotional and practical support needs of the parents. B. The second option. A follow-up appointment is important but does not provide immediate support for coping. D. The fourth option. Relaxation techniques are helpful but do not address the practical support needs of the parents. Clinical tip: connecting families with community resources and support services can greatly enhance their ability to manage complex care needs at home, reducing stress and improving outcomes. A 19-year-old male visits the clinic for a routine checkup. He is a college student who is physically active and has no significant medical history. During the assessment, the nurse discusses the importance of self-examination for early detection of testicular cancer. Which statement by the nurse is most appropriate to include in the teaching? Here are the options. Option 1. Perform the self-exam immediately after a cold shower. Option 2. Conduct the self-exam once a year during your annual physical. Option 3. Perform the self-exam monthly, ideally after a warm shower. Option 4. Conduct the self-exam only if you notice any discomfort or swelling. The correct answer is C. Rationale. Correct answer, the third option. Performing the self-exam monthly, ideally after a warm shower, is recommended because the warmth relaxes the scrotal skin, making it easier to feel any abnormalities. Regular monthly exams help in early detection of testicular cancer, which is crucial for successful treatment. This practice aligns with health promotion and maintenance by encouraging self-care and early screening for young men who are at higher risk for testicular cancer. Distractor rationales. A. The first option. A cold shower causes the scrotal skin to contract, making it difficult to detect any lumps or changes. B. The second option. Annual exams are not frequent enough for early detection. Monthly self-exams are recommended. D. The fourth option. Waiting for symptoms like discomfort or swelling can delay early detection, which is crucial for effective treatment. Clinical tip: encourage young men to perform testicular self-exams monthly after a warm shower to detect any changes early. Early detection significantly improves treatment outcomes for testicular cancer. A 65-year-old client with non-Hodgkin lymphoma is receiving chemotherapy in an outpatient oncology clinic. The nurse notices that the client is wearing a medical alert bracelet indicating a severe latex allergy. Which action should the nurse take first to ensure the client's safety during the treatment session? Here are the options. Option 1. Verify the client's allergy status in the medical record. Option 2. Ensure all equipment and supplies used are latex-free. Option 3. Educate the client about potential allergic reactions. Option 4. Inform the healthcare provider about the allergy. The correct answer is B. Rationale. Correct answer, the second option. Ensuring all equipment and supplies used are latex-free is the immediate priority to prevent an allergic reaction. Non-Hodgkin lymphoma patients undergoing chemotherapy are already immunocompromised, and exposure to allergens could exacerbate their condition. Verifying the allergy status and informing the healthcare provider are important, but secondary to the immediate need to prevent exposure. Educating the client is also important, but not the first action in this scenario. Distractor rationales. A. The first option. While verifying the allergy status is important, it does not immediately prevent exposure to latex, which is the priority. C. The third option. Educating the client is valuable for long-term management, but does not address the immediate risk of latex exposure. D. The fourth option. Informing the healthcare provider is necessary but secondary to taking immediate action to prevent exposure. Clinical tip: always prioritize actions that directly prevent harm to the client. especially in cases of known severe allergies. Immediate prevention of exposure is crucial in maintaining a safe care environment.
That's it for today's question bank session, everyone. Your score and detailed rationales will follow in tutor mode. Discover Exam ASAP, our advanced AI-powered platform with over 5,000 peer-reviewed NCLEX-style questions. With adaptive testing, audio rationales, daily updates, and 24/7 tutor support, it's designed to help you pass the NCLEX on your first try. Visit yournursingspace.com for our ultimate NCLEX mastery notes and free study guides. Like, subscribe, and check out our website for more content. Keep up the great work, and we'll see you next time.